Hi there, everyone. My name is Danny Gonzalez. I'm the Community Engagement Associate at the Los Angeles LGBT Center, and I wanted to welcome you to the Hello Club. First off, I wanted to start off by saying thank you so much for signing up to support our seniors. This has been a really trying time during COVID-19 to make sure that our seniors are well kept and well cared for. So this program is really aimed at making sure that their mental health and their mental well-being is really well taken care of. As simple as providing them a warm, friendly conversation. So we wanted to, again, thank you so much for stepping up and being part of this program. First, we wanted to start off by saying welcome. We adore you already for signing up to be part of this incredible program that really is aimed around providing fun, friendly social conversations through the phone to our LGBT seniors. So what is a social call program? A social call program provides invaluable connections to our LGBT elders. What we've seen is that there is elevated risks of loneliness and social isolation due to the COVID-19 pandemic, forcing our seniors back into their homes. And really, this program is aimed to bridge that gap to ensure that our seniors are reminded that they are loved, that they are cherished, that they are valued as individuals and as community members. And really, all it takes is picking up the phone and asking them how they're doing. And so this program is aimed around just building those social connections and ensuring that they're reminded that they are not alone in this. So why now? Social isolation affects nearly 1 in 5 older adults. And with the COVID-19 pandemic, that has increased exponentially. And what we've seen is that really chronic isolation, leads to chronic illness. For example, it leads to higher susceptibility for the flu, greater risks of heart disease, and earlier onset dementia. And so really what we're trying to do is to combat the physical effects of isolation by ensuring that our seniors are well taken care of and that people are reminded of them and that people are looking out for them as real human beings and offering them genuine human connection. So your responsibilities as a Hello Club volunteer are pretty simple. They really fall into these 2 categories. You're going to follow a provided call script and offer our LGBT seniors a warm, friendly conversation. That means really just talking to them as a human being and ensuring that they're listened to, that they're feeling listened to and provided with any sort of resources that they may need. And the next one, which ties in, are taking notes within our phone dialing system to ensure that our seniors' needs are tracked and that us at the LA LGBT Center are able to dispatch staff members and ensure that all of our seniors are well taken care of. And we're going to go over that in a couple of slides as well. So what you should expect. So our Hello Club is ran using a phone dialing system called Call Hub. That provides us anonymity and provides us an entire user software that you're able to guide through and make calls through. Calls are able to be made from 10 a.m. to 7 p.m. any day of the week, from Monday through Sunday. And we really designed this program to be flexible and allow you to make calls at your own leisure. We recognize that so many people's schedules were really flexible and moving around during the pandemic. So we wanted to make sure that this program was one that you're able to do remotely entirely and that you're able to just pick up the phone, whether that's at a lunch break or you're done with work for the day, or you're just starting your morning at 10 a.m. and you want to start off doing something warm and friendly. This is a great program for you. Another thing that you should expect is that our seniors already love you. They have signed up to receive these calls and they look forward to them. They've at this point received well over 10 calls and have been part of the program for over a year now. So you know who a Hello Club volunteer is and they know what to expect and they're willing to talk to you. They're willing to have a nice friendly back and forth and to be reminded that somebody out there is looking out for them in a real way. And you should also expect that we are going to provide you with a call script so that way that you're able to navigate the conversation and ensure that all of our needs for our seniors are addressed. So next, we're going to be going over the actual physical call script and what you should be expecting as you go through each question and you feed it to our actual seniors. First, we start off with an opening line that we find very helpful, which is just, "Hi there, this is Danny calling from the Hello Club at the Los Angeles LGBT Center. Is this a good time to talk?" This ensures that, if there's something going on, like an emergency with the senior, they're not going to tell you that this is a good time to talk. This is a great green light to say, "Yeah, I'm buckled down and I'm happy to just chat with you." Next, you're going to go into really the meat and potatoes of the conversation. We start off with these icebreakers to get the conversation flowing, but this is really a nice open-ended broad section that we really hope that you fill with your own conversational skills and whatever feels natural within our seniors. You can start off with one of these questions such as, "How are you doing? How are you spending your time? How are you feeling?" You can discuss ways that you've been distracting yourselves while homebound, or even be creative and think of your own versions. For example, I have a beautiful cat named Thomas, and I love to bring him up at any interval. And you'd be surprised at how many seniors actually have pets. So if you bring up your pet, that gives you an avenue to chit chat about pets for the next 30 minutes. And for those 30 minutes, our seniors feel listened to and warm and friendly. And so it's just really creating a conversation that feels natural and flows well for the both of you. We want this to be a conversation that feels natural, feels good, and feels genuine for both parties involved. Next, we want to ensure that our seniors have all of their needs assessed and that they are getting the care that they need to go through the COVID-19 pandemic and come out of it stronger on the other end. So we always ask this question. Before we hang up, I wanted to see if you needed assistance in any of the following areas: housing, legal, government benefits, mental health, medical, case management, or essential/food items. And basically our senior can just tell you, yes, I need help with housing. My landlord is going to kick me out. And all you have to do is type into the notes, senior needs help with housing. You're not expected to be an expert in any of these fields. You're just supposed to give us a heads up that this senior needs a little assistance in a certain field. And that gets transmitted over to our senior services staff who get to reach out to the senior directly and make sure that everything is bridged and everything is handled on our end as well. But this is you being a real lifeline for our seniors and ensuring that if they have a need, that it is flagged within our notes section right here. And that gets transmitted over to the LA LGBT Center staff. We also wanted to let you know that if there's any sort of emergency or something that you think is of higher urgency, you can always give out this number to either our seniors or you can call this number yourself. It's our senior help desk phone number, and it's 323-860-5830. And this is actually going to be the caller ID that each senior sees when they receive a Hello Club phone call. So they won't actually see any of your personal information or any of your personal phone numbers. They'll just be seeing the senior help desk phone number. So if they call you back, they're going to be directed directly to senior services staff. Next, I wanted to go over some do's and don'ts around the program. First, we wanted to really emphasize that we want you to please do have a fun, friendly conversation. This is a great program for both you and the seniors, and we want you to enjoy it in a thorough way. Please do be sensitive to issues regarding culture, religion, values, and other areas of potential difference. Sometimes there's generational divides regarding some subjects, but sometimes, it's just nice to avoid conversations that feel a little icky and pivot to conversations that feel warm and friendly for both people in the program. So that's what the next do is feel free to redirect. If something is getting a little sticky, if the conversation has flowed in a direction that you're not super comfortable continuing in, you can feel free to pivot. For example, if somebody wants to talk about a conversational point around politics that you're not really comfortable talking about, you're able to say, hey, that's an interesting point of view, but I prefer to talk about something else. How's your dog doing? Or are you watching any good movies, reading any good books? It might feel uncomfortable in the situation, but we prefer that you feel uncomfortable in a 1-second pivot than to feel uncomfortable in a long-standing conversation that you don't really want to be a part of. So of course, feel free to make the conversation something that you feel comfortable with as well. Next, we wanted to go over some don'ts. Please do not accept gifts or tips. Our seniors are wonderful humans, but unfortunately, it's just not part of our program policy that you're able to accept gifts or tips. The next two go together pretty well. Please do not give out financial advice or medical advice. We are not experts, nor are we expected to be experts in financial or medical advice for any of our seniors. You're able to, offer broad advice like going to the doctor is good, things of that sort, but we really prefer that you just stay away from any sort of financial or medical advice, just in general, to ensure that no confidentiality is breached in that sense. The next one also is an important one. Please do not give out your personal information. Our seniors are lovely, and incredible people, and they're warm and friendly, and we understand that friendships will blossom from this program naturally. We wanted to ensure that you don't give out your personal information to ensure that we set up some healthy boundaries and ensure that our seniors, if they get your phone number, aren't calling you at 9 p.m. on a Sunday or calling you at 6 a.m. on a Monday because that's the time that they're up. We want to ensure that there's nice, healthy boundaries, so we just ask that you don't give out your personal information. The next one is we ask that you please do not overshare or over-personalize. This program is really designed for our seniors more than anybody else. But of course, it is a conversation, so there is a natural back and forth. And we invite you, as much as you're comfortable, to share bits about yourself, to really encourage our seniors to really open up about themselves as well. But we don't want this conversation to be around you and how you are doing and the books that you're watching. We want this to really be about our seniors and the movies that they're watching and the books that they're reading, because that's what the program's intent is around. So of course, there's some natural back and forth, but just don't over personalize it. And when all else fails, just bring it back to our seniors. If they're asking you about your dog, give them a good, honest answer, but then ask them how their dog is doing, things of that sort. Next, I wanted to go over some resources that the Los Angeles LGBT Center actually provides for our seniors. So that way you know exactly what our seniors can actually be connected to within the center. First, we actually are a federally qualified health center, which means that we are able to address our seniors' medical and mental health needs. We have in-house doctors and nurses that are specially trained in LGBT-specific care, as well as a robust mental health department that has trained therapists who have specialized in LGBTQ treatment. As you can imagine, during the pandemic, we've seen more people who have come to our services, and so the wait times have increased a little bit, but this is an in-house service that we definitely do provide to our seniors. And the next, as I mentioned before, is our Senior Services Department. It is an incredible program and department that provides our elders with case management, food delivery services. They host virtual and in-person events, including hot meals every single day, showers, bereavement groups, and it's an incredible, incredible space that we really encourage all of our seniors to take advantage of. And ensure that, you know, when they feel comfortable coming back in person, that they feel comfortable coming back to our Senior Services Department as well. And if there's any ever need for connection to our Senior Services Department, again, as we mentioned before, you can connect folks to the Senior Services Helpline at 323-860-5830. So that is, you know, that's it for us right now. This is the Hello Club training, and we're so grateful that you have signed up to be part of this program. There's an additional training for our Call Hub software to actually walk you through and tell you exactly which buttons to be clicking as you go through the software. But for now, this is a general overview around who we are as the Hello Club and what you're going to be joining. And we want to say again, thank you so much for signing up to be part of this incredible program. We cannot thank you enough for doing what you do and prioritizing our seniors in a real way. If you have any sort of questions, feel free to email me at da.gonzalez at lalgbtcenter.org. Thank you so much, and we look forward to working with you. Bye now.